1. My daughter had just reached the age when she started menstruating, and she wasn't feeling well. She appeared very pale, bruised easily, and was always tired. Clear signs of anemia. I took her to the doctor at the nearby Air Force Base. My husband worked for the Army and was stationed locally. The doctor who examined her, after gathering a list of symptoms and without performing any blood tests, quickly diagnosed her as a troubled teen. He pushed me hard to have her admitted to an institution, which left me completely shocked. After seeing another doctor privately, he decided to run some tests, and before the results were in, he confirmed that it was indeed a severe case of anemia, and that she could have been in serious danger if left untreated. The tests verified his diagnosis. He prescribed a specific type of iron, and as long as she took it, she was back to normal. And for those wondering why I didn't just buy over-the-counter iron, her symptoms seemed very intense to me, though typical. It seemed safer to get a professional opinion. 2. My baba, my Ukrainian grandmother, went to her doctor for a routine checkup, and the doctor advised her to stop eating sour cream, stick to white chicken meat, and avoid chicken thighs. Switch from rye bread to whole wheat, and stay away from pickled foods like herring and beets because they weren't good for her health. She was 87 years old and responded by telling him that she had already buried 3 doctors and would bury him too, but she promised she would switch to lighter sour cream. 3. I could probably write an entire book on how the medical field failed me, but I'll focus on this. While fighting breast cancer, dealing with fibromyalgia, and also suffering from kidney stones at the same time, I was in extreme pain. I was given Toradol. The worst abuse of power I've seen in the medical field is when doctors ignore a patient's pain, and unfortunately, I've seen it repeatedly in my own care. 3 oncologists refused to provide me with pain medication after my chemotherapy regimen was adjusted. Although I was still receiving some medications, they weren't the kind that cause hair loss anymore. These drugs caused sores on my arms and pain in my joints and hands. After my cancer surgeries, I woke up screaming and shaking due to insufficient pain medication. Treating patients like drug addicts is one of the most ignorant and harmful things I've witnessed. 4. At 10 years old, I had never been concerned about my weight. I wore comfortable shorts and loved this colorful unicorn tank top I had, which I wore frequently. I was just a healthy, active girl who loved playing and eating well. But then during a regular checkup, the doctor showed me a weight chart. She pointed to a spot on the chart and said, "This is the weight you should be at your age." Then pointed to another spot and said, "And you're far over here. You need to eat less sugar and exercise more." After that visit, when I looked in the mirror, I couldn't see that playful, healthy girl anymore. She was gone, replaced by a girl who started to measure her worth by her weight. My comfortable shorts became forgotten at the bottom of my dresser. And every time I thought about wearing my unicorn tank top, all I saw was fat. I never wore it again. The shorts I'd outgrown without even getting a chance to wear them. And the dresses I used to wear were replaced with oversized sweaters. The doctor's words echoed in my head, and I began to develop unhealthy habits like binge eating and restricting myself. Now, as a teenager, I've lost sight of that joyful girl and can only see flaws. I would have probably become insecure eventually, but the doctor's words didn't help. I was healthy and active at 10, and there was no reason for her to make me feel that way. Even though it's been a long time, I still remember how she made me hate myself. I believe she's a good doctor, but showing me that chart and saying those things was thoughtless and hurtful. 5. My first daughter was diagnosed with failure to thrive. At 7 months old, she had only gained from her birth weight of 6 pounds, 11 ounces to 12 pounds. Despite our constant efforts to get her to eat, after eating just a little, she would cry in pain, which was obvious to me. We took her to a doctor who dismissed my concerns, calling me a hysterical young mother who didn't know what she was talking about. He even called child services on me, accusing me of not feeding her. He probably thought I had Munchausen syndrome by proxy. He referred us to a pediatrician who also ignored my worries, claiming she was just playing with her voice. When I insisted something was wrong, I was again labeled as an overly dramatic young mother. At 7 months, we rushed her to the emergency room at McMaster University Medical Center, where they actually took her condition seriously and discovered stage 4 cancer. It had begun in her liver, and she was in severe pain when eating, which was likely due to the swelling from the tumors. She passed away because doctors refused to believe me. 6. Several years ago, I changed my primary care doctor and saw the new one for the first time, probably for something simple like a sinus infection. During the visit, he made small talk and asked if I had children. I told him not yet, but my husband and I were considering adoption. He asked if there were any medical reasons for us to adopt, and I explained that we just saw it as an option. He replied, "If you can have your own biological children, don't adopt. You won't bond with an adopted child the same way you would with your own." A nurse was present and immediately challenged him, saying something like, "Why would you assume that? I know plenty of people with both adopted and biological children." The doctor tried to argue, saying, "But if they were totally honest, they'd probably tell you they feel closer to their biological children." The nurse and the doctor went back and forth, and I agreed with the nurse. I'm glad I didn't listen to him. My husband and I went on to have 2 biological children and adopt 1. We love all 3 of them equally, and each one is unique in their own way. I'm grateful for that. 7. When I was in my mid-20s, I began gaining a lot of weight, so my doctor put me on a strict diet. I followed it exactly, even weighing my food to the gram. It was a 1,200 calorie a day diet. I was always hungry, low on energy, and still gaining weight. 2 months later, I went back to see the doctor. He noticed I had gained 30 pounds and asked why I wasn't following the diet. I told him I was, but admitted it was really difficult. He looked me in the eye and said, "If you were actually following the diet, you would have lost 30 pounds, not gained it." I left that appointment in tears, feeling like a terrible person. A few months later, I switched doctors for unrelated reasons, and it only took my new doctor a few weeks to diagnose a small tumor on my pituitary gland. After the tumor was removed, I was able to eat 2,000 calories a day and lost nearly all the extra weight within a few months. It's shocking that a doctor would rather assume a patient was lying than investigate why their body wasn't responding normally. 8. When I was 5, I started having frequent migraine headaches. My parents took me to a doctor, worried that I might have a brain tumor. This seemed reasonable to them, since it was unusual for a young child to have regular headaches. I was having episodes once or twice a week, which involved vomiting, screaming, and being extremely sensitive to light. The doctor examined me and told my parents that the problem was that I was an only child, and if I had a sibling, the headaches would go away. He sent me home, and I continued to suffer. To this day, I'm not sure what the basis for this diagnosis was, but it was likely a product of the 1970s, when myths about only children were common. I eventually got a younger brother, and later a half-sister. But I kept experiencing migraines throughout my childhood and into adulthood, and I still get them occasionally in my late 40s. 9. My mammogram results showed no signs of any tumors. When I read the report, both breasts had the exact same description. The doctor had written the same thing about both sides. I then had a sonogram, which revealed 3 malignant tumors in my right breast, which had spread to my lymphatic system. I was in stage 3. After chemotherapy, surgery, radiation, and nightly medication, I'm doing well. 10. I suffer from severe neurological conditions and was having difficulty opening my mouth. I asked my neurologist if this symptom was connected to my condition. He asked me how wide I could open my mouth and commented that it was severely limited. His next statement was, "At least you'll lose weight." I wasn't overweight. He didn't offer any further suggestions. A week later, when the condition worsened, it was discovered that it was a life-threatening reaction to a medication. I wish this was the only bad experience I had with the medical profession.